trying to provoke anybody to do anything particular? Were you trying to provoke or trying to get people to do things?
Yes.
Tell us what.
Think. Use your head.
Testing to care workers who have symptoms or house
Sorry,
Hang on. I want to show you this. Daily Mail front page says. The Daily. I'm showing viewers the Daily Mail front page.
Okay.
I don't know why you're laughing. Why are you laughing?
Well,
she can't see it.
You said
I'm telling you what it is. It's actually very serious. It says 4,000 people may have died in care homes in this country. To which my point to you is, why are you only now doing all this testing? Where were these tests a month ago? What has been going on with our government testing?
My reaction just then was because you said you'd show me something, and that I've been asked to set up the camera so that I'm looking into it, so I can't see what
Listen, it's fine. I was telling you what the front page said. I mean, is it true that 4,000 people have died in care homes?
So we have been working incredibly hard.
I'm not sorry, Miss Whaley. It's not a question about how hard you're working. I assume you're working hard. You're the care minister. It's your job to work hard. Please stop telling us how hard you're working. What I want to know is it true that 4,000 people have died in care homes? Yes or no?
I wasn't actually talking about me personally. I was talking across the whole of health and social care, across local authorities, across care providers and their representatives, working to make sure that we're doing everything we can to protect vulnerable people.
Yeah, well, I assume you're doing all that, but is it true that 4,000 people have died in care homes? Yes or no?
Okay, well, I'm glad you appreciate that we are doing that. I think it's really, really important to take the steps that we can.
I'll tell you what's really important is that you just answer straight questions. Is it true that 4,000 people... Why are you laughing?
I'm coming to answer your question, but I'm not...
What do you find funny about this?
I don't think it's funny in the slightest.
Well, why do you keep laughing then?
I'm not laughing at all.
I literally just asked you, is it true that 4,000 elderly people have died in hospital and all you can do is laugh? What's the matter with you?
I'm not laughing. Please don't suggest for a minute that I'm laughing.
We literally just saw you laughing.
I have not been, but it feels like you're shouting at me, not giving me a chance to answer.
I've asked you a question 3 times now and you won't answer it. Is it true? Let me try one more time. Is it true that 4,000 people, elderly, vulnerable people, have died of coronavirus in our care homes, as the Daily Mail front page says?
So the data we have from the ONS, which is the source of robust, reliable data, tells us that up to April the 3rd, 217 people died of coronavirus in care homes. I believe, because I've been talking to care providers and representatives of the care sector, that since then, very sadly, more people have died in care homes.
How many?
And we are working to make sure that we have that data, but it's really important that our data is accurate and timely.
Well, how many more do you think may have died? Give me a ballpark.
No, I don't think it's appropriate for me to give you a ballpark figure for something as serious as this.
What's appropriate is that you, as the care minister, should have some idea of how many people are dying of this virus in care homes.
No, I don't think I should be speculating on number of deaths. What's really important
No,
is
I'd like the information.
Well, as would I. And as, in fact, the Medical Director for Public Health England said yesterday in the afternoon press conference in 10 Downing Street, is what we really want is to have the full picture of the numbers of people who are very sadly dying from coronavirus, both across hospital and in the care sector and in other places in the community, so that we've got the full picture. And we're working to make sure that we have that data. It's not data that was collected on a daily basis in the past because we weren't in a pandemic a few months ago. So we're taking steps in order to collect that. And as soon as we have that data, both it will mean that we have an accurate picture in government and we will share it with people as we have been doing the whole way through.
Can I ask about, Helen Whately, can I ask about something you said about testing? Because there's been huge criticism of the fact that people have not been tested in care homes and care workers do not know the extent of COVID. They don't know if they're suffering from COVID or if somebody in their family is. You have now said that care homes, care workers will get tested. But you said something quite significant, which is that if they're showing symptoms. Now, if there is a resident showing symptoms in a care home, shouldn't it be the case that all the care workers in that home should then be entitled to a test? Or do they have to wait until they have symptoms to be given a test?
So we have followed the advice of the Chief Medical Officer and the medical experts, and we know that the testing is much more reliable when somebody has symptoms. So the important thing to do is test people who have symptoms. And the reason, particularly for introducing this for care workers, is because at the moment we know that in many care homes and also home care providers, they're struggling with staff who are absent, who may be off sick with symptoms, or are isolating because somebody in their household has symptoms. But as we test, what we will find out is that some of those people who have coronavirus symptoms actually don't have coronavirus, which would mean that those workers can come back to work, which will mean that we have more people
so
who care for those in
you're
our care
going
homes.
to give care workers the same right as the Cabinet Minister, Michael Gove, which is that if a member of their family shows symptoms, you will be able to test that member of the family, which means that they wouldn't have to isolate, for instance, if that member of their family didn't have COVID.
Yeah, that's absolutely right. That's what we're doing for the NHS, for NHS workers and for workers in the care sector.
And
yes,
why has it
right.
taken so long to do that for care workers when a member of the government has been entitled to that test?
So what we've been doing is increasing the numbers. As I said, we're ramping up the numbers of testing. And as we do so, we're making sure that those who most need the tests are able to get them. And for instance, look at
and is a government minister who can work from home more of a priority than a care worker who cannot work from home?
So I've argued very strongly for us to make sure that we prioritise care workers in the testing.
So why did Michael Gove get one then for his daughter?
Ultimately, it is a clinical judgment which is being made to decide who should be prioritised.
Well, Michael Gove went to the Chief Medical Officer and asked for special dispensation for his daughter to have a test so that he could go back to work. You've just said the priority is health workers. Again, I ask you, given Michael Gove can work from home like almost every politician is doing, like you're doing right now, why did Michael Gove get one so that he could go back and do his normal life?
I can't comment on conversations that may or may not have happened between Michael Gove and the Chief Medical Officer. What I do know is that there is a clear system for identifying who should be tested.
There's a clear system that government ministers, whether you're Boris Johnson, whether you're Matt Hancock, whether you're Chris Whitty himself, the Chief Medical Officer, whether you're Michael Gove and his daughter, there's clearly a priority being given to politicians, as there has been for celebrities, and it has not been given to the frontline health workers and care workers who most desperately need it. Matt Hancock suggested, in fact, let's play the clip of what he suggested.
There's high demand for PPE from within the UK, so everyone should use this equipment, use the equipment they clinically need, in line with the guidelines, no more and no less.
So, do you agree with his implication there that some of the PPE is being wasted by our health workers?
So the Secretary of State is absolutely right that PPE is a precious resource. There's global competition at the moment for stocks and supplies of PPE. Countries around the world are scrabbling to get their hands on it. We have been drawing on our pandemic flu supply, which has meant that we've been able to get PPE out to hospitals, GPs, pharmacies, care homes all around the country. It's been really hard to meet the level of demand that people want.
Has any of it been wasted, was the question.
Well, we've also given very clear guidance, as clear as you possibly can, Public Health England's published guidance on how you should use PPE. I do know that people would like to be using PPE more than the guidance sometimes says, because sometimes people want to use it for everything on a...
Once again, my question was,
basis.
as Matt Hancock suggested, has it been wasted? Have people been wasting PPE?
I actually don't. I think you're taking words, you're using words that he didn't use. What he made quite clear is that PPE is a precious resource. We're doing what we can to increase the supplies to get more made within the UK, as well as getting extra supplies from overseas.
All right, do you think any of it's been wasted, yes or no?
I think the important thing is that we make sure it's used for what it's needed for. so that we make sure that the supplies that we have are used for the right thing, so those who need it have got it.
Our final question. We had Teresa Coffey on yesterday. Asked her a simple question: how many health workers and care workers have died from coronavirus? Do you know the answer?
So, your focus on figures slightly blows the fact that we're talking about individual people's lives here, and every life
I just
lost
asked you how
is
many health
somebody's-
workers and care workers have died from coronavirus on the front line. Do you know the answer?
So the latest information we have for NHS workers is that 19 NHS workers
That's
have very
complete
sadly
nonsense.
died.
The Mirror had 38 yesterday. It's complete
So the
It's
Mirror
complete
may-
and utter
may
nonsense.
have that, but I don't get my data from newspapers. I have
Okay.
to get it from the NHS and from our scientists. And I say that's in the NHS. We know that we do have.
So to clarify, the
frontline
cares
workers
minister,
dying in the care sector.
to clarify, Minister, you believe that only 19 health workers and care
Okay.
workers have died, do you?
The data that has been reported to me of confirmed deaths of health workers is 19. We know that also some workers have died who work in social care, and I'll be straight with you. We don't have a figure for that.